Thank you, Chairperson, and it's an honor to be chaired by somebody who is an expert in yoga. We'll talk about it during the course of the talk. Thank Dr. Mohan and his team for inviting me for this talk on stress and diabetes. I gave a similar talk several years ago at this conference on stress and diabetes, and we moved quite a bit after that. I've added the word stress coping to stress and diabetes to focus and let you know that this is far more important than the stress itself. And we'll see over the next 15-20 minutes how it's more important to focus on the stress coping and how can it lead to non-communicable diseases such like diabetes, and then what can we do about that. So the focus of my talk is going to be, basically, we all know it's a two-way link. We'll talk about stress more as a risk factor for type 2 diabetes and distinguish between stress itself and stress coping, and how stress coping can increase the risk for diabetes, through which mechanisms, as we all know. And can type 2 diabetes be prevented by enhancing stress coping by some means? And SOC is something we'll talk about. And then come to yoga and prevention of diabetes, and particularly as a stress mitigating strategy. And is that the real reason why yoga benefits? We'll look at all these over the next 15-20 minutes. So we all know that stress is two-way. Diabetes is associated with stress and stress-related illnesses. And stress is associated with the development of diabetes, and the two conditions worsen each other. So this is the first basic thing that we need to understand. One leads to the other, and one each worsens the consequences of the other. There are several studies which say that depression and anxiety are higher in type 2 diabetes patients. We did a study in Delhi and found similarly high incidence of depression. But more importantly, in the first 2 years after diagnosis, anxiety was far more important, to the extent of 40%, and therefore suggesting that this is enough stress-related illnesses in those diagnosed with diabetes. And of course, the various parameters of biosocial stress in women in Delhi was also looked into in a biocultural study and found to be more important, but most of it was buffered by their social roles at the cost of hyperglycemia. These two studies just reinforce the fact that diabetes can result in a lot of stress and consequences. But as a risk factor, which is the main focus of this talk, has been an important critical factor which is associated with urbanization, but the two have been believed to be associated for a very long time, but actual evidence has never been direct. Earlier experimental and human studies suggested that stress could cause diabetes, but the main evidence has emerged only in the last 3 decades or so. And we did a study also, ICMR sponsored, about 15 years ago, where we showed that chronic stress, sense of coherence, we'll talk about that a little more, and through various stress scales were actually indicated that experiencing more stressful life events leads to diabetes, and also a decrease in coping ability, which is actually marked or measured by sense of coherence, a decrease in that results in a higher risk of developing type 2 diabetes mellitus. There are several correlations with glycemic parameters, insulin secretion, insulin resistance, which also was documented in the study. But the most important thing that stood out, as we will see, is the stress coping measures. To give you a background, we all talk of disease, which is pathogenesis, factors resulting in, or risk factors resulting in disease. We don't talk about salutogenesis, which actually is wellness. And only the focus these days is more on healthness and how do we stay healthy. And therefore, when we talk of salutogenesis or being healthy, we are talking of coping mechanisms. That means we are faced with a lot of stresses of various kinds all around, but whether we remain well or no in this noxious environment, so to speak, depends on our ability to cope. And that's the basis of the talk. And therefore, coping actually is a complex of behavioral, cognitive and physiological responses that aim to prevent or minimize unpleasant or harmful experiences that challenge one's personal resources. That means you may have noxious stimuli all around, but if you're able to cope with it okay, then you will not be affected, your system will not be affected, and continue to remain well. And this is measured by what we describe as sense of coherence. The concept of salutogenesis is important to understanding of context of any chronic disease, particularly diabetes. And therefore, this is fundamental to diabetes, and in the context of stress is even more important. SOC, or sense of coherence, is supposed to be a valid measure and a robust global measure of stress coping. This is a questionnaire-based method by which you can assess what is the SOC level. So we have a quantitative estimation which we can use in studies and even clinical practice if required, that strongly correlates to perceived health. And the concept was developed long ago to assess these successful coping strategies, and it seeks to explain why some people, despite experiencing major stresses and stressful life events, stay healthy, while others do not. And this is particularly true in lifestyle diseases and diabetes-like diseases. Persons with low SOC are more likely to deal unsuccessfully, and persons with high SOC are likely to deal with more successfully with stressful life events, and therefore it could act as a moderator of stress, and that's the importance. The hypothesis, therefore, actually is that a strong SOC is salutogenic, keeps you healthy, and a low SOC results in disease. And it has three components: comprehensibility, manageability, and meaningfulness, which we assess. And then these three components is what makes you cope with stress, particularly if you have good measures of all these three. What about sense of coherence and type 2 diabetes risk? Are the two linked? Are there any studies that link the two? The concept is fine. High levels of chronic stress and low SOC are independently associated with a higher risk of diabetes. Number one. SOC mediates the association of stress and risk of type 2 diabetes. SOC moderates the effects of chronic stress on diabetes risk, and therefore there is a close relationship between SOC or coping ability and the risk of diabetes. Two earlier studies actually showed that low sense of coherence is linked with type 2 diabetes mellitus in Swedish women, and another one in a long-term 17-year follow-up study also showed that low SOC was associated with 40% or 46% increased risk of diabetes. So there is a clear link between these two conditions. And our study, again, if you see the bottom part of this slide, it very clearly shows that the most important parameter, which actually in stepwise logistic regression analysis correlates as an independent risk factor, is SOC, besides the other studies. And it emerged actually as the strongest independent predictor of diabetes risk. An odds ratio of 0.77 saying that a 23% lower risk of diabetes if your SOCs were good. This points to a significant independent protective effect of SOC, and we've been talking about how SOC can protect against chronic disease on diabetes risk. Therefore, there's a clear link, and even from our own studies, very clearly shows that it can protect, number one. It has also been shown to mediate the effects of PSS on the risk of diabetes. PSS is another way of assessing stress, and it is SOC which mediates the effect of perceived stress scale on diabetes risk. So, suggesting that not only it has a direct effect, it also mediates the risk of other perceived stress factors. And it also has clear-cut effects, inverse relationship with glycemic and insulin resistance parameters, and a positive correlation with insulin secretion. So it affects insulin resistance, So when we talk of stress, we are actually more talking about stress coping measures. Same thing in a graphic form. This study, when we actually looked at the cortisol levels, again, when we include cortisol levels as well, still, apart from body mass index, which we're all familiar with, the SOC and the 10 ppm cortisol are the ones which correlate best with risk of diabetes, suggesting that a chronically hyperactive and dysregulated HPA axis, probably linked to a low SOC, is what sets off the risk of diabetes. Moving from there to a little bit to AVP, which is we all know as a pituitary hormone, HPA axis and diabetes risk. As we all know, apart from the CRH, AVP is another hormone which actually stimulates or regulates the HPA axis, and which is the main stress regulating axis. And therefore, the stress response in AVP, there is a very close link. Clinical as well as experimental studies show that under chronic stress conditions, and when we are dealing with diabetes, it's a chronic stress, not acute stress, AVP plays a more dynamic role, and probably even the CRF neuron starts secreting AVP, and that's what results in activation of this pathway, resulting in high cortisol levels in diabetes. In a study which is still unpublished, but basically a MD thesis, we found that copeptin, which is actually a measure of this AVP axis, correlates with glucose metabolism directly. And there is a big difference in glycemic parameters between lowest and highest quartiles of copeptin, even when we control for osmolarity in the body. But this is far more important. In patients with varying degrees of glucose intolerance, there is a clear association of copeptin with sense of coherence. We come back to the same. The measure of stress coping ability correlates very well with the copeptin levels, suggesting that probably it's the depending on what your SOC is, the activation of the HPA axis through copeptin is going to be regulated. The same thing in a graphic form, very clearly showing that SOC is lower in type 2 diabetes patients or newly detected type 2 diabetic patients, which correlates inversely with copeptin. So the summary of this part of the talk is what? The burden of type 2 diabetes continues to rise. Could stress be an important yet unaddressed risk factor? We all talk of activity, diet, and so on. Strong inverse link of stress coping abilities with diabetes risk, which we've ignored. Need to focus on strategies to improve stress coping to prevent and manage diabetes. So we need to look at stress coping strategies, and yoga is one of them. HPA axis activation is at the center of endocrine stress response, and probably the ABP pathway is more important related to the stress. And psychological distress and related issues are important contributors to morbidity in type 2 diabetes. With that, and since we've said that you need to look at measures which can address the coping mechanisms, does yoga, which is supposed to be one of the stress mitigating strategies and an ancient practice in our country, does this have any influence on SOC? Yes, yoga can positively influence a person's sense of coherence. Yoga practices including asana, pranayama, and meditation can enhance SOC by promoting a greater sense of understanding, control, and purpose of life, which are the three basic facets which I told in the beginning, the comprehensibility, manageability, and meaningfulness, same thing. So yoga has been shown to affect all the three major components of the SOC, the comprehensibility, manageability, and meaningfulness, depending on what yoga practice you do. In terms of research, although these are not extensive studies, but enough studies with small numbers, but Hatha yoga practitioners had significantly higher scores of sense of coherence. They had higher SOCs, suggesting as regular practice of yoga could actually increase your stress coping ability compared to controls. Yoga can reduce perceived stress and sleep quality, which can contribute to a strong sense of coherence again. Yoga education for 2 months led to a significant increase in SOC, self-resilience, and cognitive flexibility in women compared to control. So there is some evidence, scientific evidence, to suggest that practice of yoga can increase the SOC and your coping ability to stress. And therefore, yoga can be a valuable tool for enhancing an individual's SOC, leading to greater sense of well-being and resilience in the face of life's challenges. In terms of diabetes, we all know that preliminary evidence for a long time has suggested that yoga could have favorable effects on glycemia, insulin resistance, and lipid profile, and several yogasanas have been found to be beneficial in glycemia and diabetic subjects. So with this background in mind, we actually, from the Research Society of Study of Diabetes in India, undertook this large randomized clinical trial of yoga and prevention of type 2 diabetes. Maintain health, prevent diabetes. Although there were 2 feasibility trials in the past and 1 short-term RCT, there was no long-term sufficiently powered RCT till date. And this study, published last year, actually is the first RCT in the world to show that yoga can prevent type 2 diabetes in a 3-year intervention randomized controlled trial, where we used yoga consisting of 40 minutes of yogasanas and pranayama, which are known to affect glucose tolerance. These are some of the yogasanas that were used. In pranayama also, in a 40-minute package along with lifestyle. About 1,000 patients overall, and about 500 each were compared lifestyle alone with yoga plus lifestyle. And what did we find? There was significant reduction in the cumulative incidence and relative risk reduction of diabetes. There was a relative risk reduction of nearly 40%. 39.2%, which is huge. Many of the lifestyle studies in the country, maximum of 32% reduction. Except the DPP in the US, no lifestyle study could reduce the incidence of diabetes more than to the extent that yoga did. Even the KP survival scores showed that yoga had significant effects on endpoints over the 3-year duration of the trial. So yoga is effective, proven to be conclusively effective. I'm showing this slide just to show that anthropometry did not differ significantly over the 3-year period between the yoga and lifestyle or the lifestyle alone group, despite the substantial benefit in terms of reduction in risk of diabetes. What does that mean? It probably means, unlike the DPP, where the effects were clearly shown to be related to weight loss, only those patients who had significant weight loss through their intensive lifestyle, only to them the benefit accrued in terms of risk reduction of diabetes. Whereas in this study, despite a major difference between the two groups in terms of weight did reduce, but it was not significant across the two groups. Yet there was a substantial reduction of diabetes, suggesting that probably it's not related to the weight loss, but is maybe related to improvements in the SOC, as we hypothesized. We did not look at those parameters in this particular study, so we cannot directly say that this is the case, but we do believe that perhaps it is the effect of yoga in stress medication or on raising the SOC levels overall, which led to the risk reduction in type 2 diabetes. So the conclusion of this major trial was that a structured yoga intervention consisting of select yogasanas and pranayama over 40 minutes daily, along with standard lifestyle measures, significantly lowered the risk of diabetes in individuals with pre-diabetes when compared to those given only standard lifestyle measures. And the results therefore suggest that yoga is effective in prevention of type 2 diabetes in subjects with pre-diabetes. So our initial work on setting the tone in terms of stress being a risk factor, SOC being one of the important predictors of diabetes risk, and finally yoga showing a conclusive benefit in terms of preventing type 2 diabetes has come a long way. And the key takeaways from this trial therefore would be, it's the first randomized controlled trial with adequate power to demonstrate the long-term efficacy of yoga over a 3-year period in close to 1,000 individuals with pre-diabetes, and puts the focus on stress medication as one of the important preventive strategies for type 2 diabetes. And the novelty of the study lies in the fact that this is the first time ever that yoga in ancient Indian practice has been convincingly shown to prevent diabetes in a well-designed long-term trial. And the study, of course, has major implications both for clinical practice as well as public health and national policy. So what they've done in the last 18 minutes or so is to bring focus and attention to stress as a risk factor for diabetes, which we often ignore. Stress coping as perhaps the most important aspect of the stress-related diabetes risk, and yoga as an important stress mitigating strategy, perhaps increasing the SOC and stress coping ability of an individual, which actually has been proven through a long randomized controls trial to actually prevent substantially the risk of type 2 diabetes mellitus. I hope that convinces you that stress is important in type 2 diabetes mellitus. Thank you.